let me just say, first off, any amount of breastfeeding is important. So if a mom has, really just done the best she can and she just can't make it past a couple of days for whatever reasons, she did a good thing for her babies.
We want to empower you to make fully informed choices about your pregnancy and parenting options. Let's talk about what's next now that pregnancy has entered the chat.
Hello, and welcome back to another episode of Pregnancy Has Entered the Chat. Today we have staff RN MaryAnn here today to talk with us about breastfeeding. MaryAnn has been at TPN for about a year, and she is also a lactation consultant. So we figured who better to talk about breastfeeding than our staff lactation consultant. So welcome, MaryAnn. We're so glad to have you.
Thank you. I'm glad to be here.
So let's just dive right in. We've got or had tons of questions from moms over the years in regards to breastfeeding.
Mm-hmm.
I think there is a lot of information that is missed or a lot of moms just don't know. So we thought we'd take some of the most asked questions and work through them.
Okay, sounds great.
Awesome. So first up is, what are some benefits of breastfeeding for both mom and baby?
Okay, that's a great question. As most people know, breast milk is the best food choice for babies, human milk for human babies. And we do realize that people struggle. It's not easy.
Yeah.
But there are a lot of benefits. A lot of people only know the benefits for the baby. And that is, reduced childhood illness, reduced chance of childhood obesity, reduced chance of childhood cancers, strong immune system. Actually, breastfeeding for 3 months reduces the baby and the mom's risk of type 2 diabetes by 30%.
Wow.
Which is huge.
Yeah.
So breastfeeding sets up the baby for lifelong health. What we do early is important throughout the lifespan. And for the mom, it protects her against, or reduces the risk, I should say, of breast cancer and uterine cancer. Protects her against heart disease when she's older.
Wow.
Yeah, right?
Yeah.
And I said, if I would have known that, my daughter would still be breastfeeding. Yeah. She's a grown woman. It's just kidding.
Yeah.
But yeah, so that's huge,
Yeah.
Reduced risk of type 2 diabetes. It's less expensive. Once it gets off the ground, it can be a little difficult getting it off the ground. It can save time.
It can be a labor of love.
Mm-hmm.
Yeah.
And it helps mom's body get back to its pre-pregnant state a lot quicker.
Yeah.
Mm-hmm.
That is wonderful. I know I breastfed both of my children till they were about a year old each.
Mm-hmm.
So, and a lot of that I didn't know. I just did it really because my mom had done it and her mom had done it. So it was not a rite of passage, if you will, but I had no idea about all the benefits. So,
well, and it's interesting that you say that because it was something that you learned.
Yeah.
Right? You learned it from your mom and your grandma. And so there's a lot of people who have gone and they've never seen breastfeeding.
Mm-hmm.
There have been so many generations of babies who are not breastfed. And I tell moms now, when your kids are little and you're breastfeeding, they're going to be really interested in what you're doing. So let them watch. They're going to get over it pretty quickly. It's going to become normal, but they're going to file that away that this is how we feed babies.
Yeah.
And so you're teaching them.
I think that's incredible. That's incredible. So getting started, I think there is maybe a misnomer, if you will, that breastfeeding is painful. So is it always painful? Are you just destined to have this journey of sacrificing pain for the outcome? Or
So no, it should not be painful. Sometimes in the first few days, it might be a little bit uncomfortable. But toe curling pain is not good. Who wants to do that every 2 to 3 hours? I wouldn't do that every 2 to 3 hours.
no way.
So we really want to make sure, and if you can't figure this out yourself, get the help of a lactation consultant. You want to make sure the baby is latched well. We always say they're breastfeeding. They're not nipple feeding. So they need a big mouthful of breast tissue. You want to make sure that they're nice and close. A lot of people think that the babies need breathing room. They need to be tucked up tight against the breast, and their little noses push the breast tissue out of the way so that they have breathing space. Sometimes making breathing space by, pushing in on your breast near their nose can actually change the position of the nipple in the baby's mouth, and that can lead to soreness.
Okay.
So if you have, that nice deep latch and you've got, the baby very, very close and you're still having pain or your nipples are just raw, you get some help and get help sooner rather than later, because it doesn't have to be that way. Sometimes there's some underlying things that can be going on that somebody with a trained eye needs to look at.
Okay. Okay. And then I know, as far as do you recommend some of the nipple creams that are on the market, or the shields, or?
So as far as nipple creams go, I'm a pretty simple person. Less is more.
Yeah.
What I was always taught and what I recommend that people do is always, after every single breastfeeding, express a little bit of breast milk. You rub it into the nipple and areola. You let it air dry.
Okay.
It's got antifungal properties. It's got antiviral properties, antibacterial. It is like magic. It does all the things. It's got fats in it, which a lot of the nipple creams are just fats.
Yeah.
So it's got fats in it. And so that can keep the breast really healthy. As far as a nipple shield goes, I know sometimes I'm seeing people get them at baby showers.
Yeah. Yeah, I've seen
not
it.
really a cool thing. The instructions on the nipple shield, if you read the fine print, say they should be used under the supervision of a lactation professional.
Yeah, makes sense.
Because if somebody needs a nipple shield, there is something going on that you should have, again, a trained eye looking at.
Gotcha. Makes sense. So don't jump straight to a solution
shield
for a problem you might not even have.
Right.
Yeah.
And also people use a nipple shield because their nipple hurts and maybe their nipple stops hurting. But if the baby's not latched onto that properly, there can be problems with milk transfer. And so there needs to be some monitoring with that tool.
Sure. And how long, I know there's also controversy over how long you should breastfeed. So a week, a month, 6 months, a year, 2? So is there any recommended amount of time to breastfeed?
So there's our minimum recommendations. Let me just say, first off, any amount of breastfeeding is important. So if a mom has, really just done the best she can and she just can't make it past a couple of days for whatever reasons, she did a good thing for her babies.
Yeah.
But what is recommended by the American Academy of Pediatrics is exclusive breastfeeding or breast milk feeding for the first 6 months. And then through the first year, but with complementary foods added, the breast milk is still the primary food. And into the second year, and then as long as the mom and the baby are comfortable with it.
Okay.
Actually, a lot of people don't know this. I learned this in the last couple of years, is that the baby's immune system's not fully established until 5.
Oh, wow.
And so there are benefits to breastfeeding longer. And when they're older, they're not breastfeeding every 2 to 3 hours.
Right.
It might be once a day.
Yeah.
Once every other day. When they get a boo-boo.
Yeah. Like a comfort.
Yeah.
Yeah.
Mm-hmm. Mm-hmm.
Okay. So speaking of, how long and, when should you start? We have heard a lot about colostrum. What is colostrum? And when do you get it?
So it's a lot of people think they don't have milk when the baby's born, but your body actually starts making milk between 12 and 16 weeks, closer to 16 weeks. You start making colostrum. And that is the first milk that your baby needs. And it's vital. It's very thick. It's yellow. I say it's like trying to drink honey through a straw.
Yeah. It's
not always super easy to get out of the breast, but if the baby's latched on, they can get it, pretty easily because the body is able to do its job.
Yeah.
It's higher in protein. It is lower in sugar. And it's very low in fat. It's loaded with immunities. When babies are born, their intestines, they don't have they're not tight. They're not sealed well. And so colostrum helps to seal off the gut, and that keeps foreign proteins from invading and helps reduce the risk of allergies later.
Oh, wow.
And so it is super It's a very important first food.
Yeah.
Sometimes you're only making about a teaspoon at a time, but babies don't need a lot of volume when they're born. And as they continue to feed frequently in the first, 2 to 3 days, then the milk starts to come to volume and it, increases. And then there's more there for the baby.
So it's kind of like baby's first pre or probiotic.
It is. Yep. It's the first immunization, really.
It's amazing how our bodies are made to tailor, that baby growing inside of you.
It's amazing.
Yeah.
It really is nothing short of a miracle.
Truly. So speaking of frequency.
Okay.
What would be considered cluster feeding? What is cluster feeding? Does it happen to every mother and baby?
So babies need to eat, we say 8 or more in 24. Okay. In a newborn, for the first couple of months, even 12 times a day is not unusual. We as adults put something in our mouth about every 45
yeah,
minutes.
I was going to say probably more than 12 times a day.
whether it's a piece of gum or, some candy or something like that, or a full meal. And just babies, sometimes they just need a little drink and sometimes they need a full meal. So with that being said, their babies breastfeed a lot. They eat a lot. Okay.
Yeah.
And it's good. Smaller volumes are better for all of us.
Yes.
So cluster feeding is when we get this nonstop feeding. And it could be every 30 to 60 minutes. And you're like, what is going on? Why is the baby so hungry?
Yeah.
And so that is actually normal. We see that at growth spurts. Somewhere between like 7 and 10 days, you'll see it for a couple of days, 3 weeks, 6 weeks, 3 months, and 6 months. This nonstop feeding. As the baby starts to sleep longer at night, they're going to get up and they might eat several hours in a row, or sometimes they eat several hours before they go to bed. Now that is not cluster feeding. That's getting in the normal feedings in a shorter amount of time.
Okay. Yeah.
And so the cluster feeding is just that nonstop feeding. It's probably going to be more than 12 times in 24 hours.
Yeah.
And it also, that frequent feeding it's good because it actually helps with reduced pain. Growing hurts. And there is pain relief in breast milk. It fills in the pain receptors to combat
better than Tylenol.
discomfort. Yeah. That's why when a baby gets a little, when they, bonk their head or cut their finger or something, they want to feed. It's little toddlers because it's comforting and it helps take away pain.
Makes sense.
So go ahead and feed them. And if it's lasting more than 2 or 3 days, you probably need to see a lactation consultant and see what's going on. Okay.
And I know you shared something really interesting with me that I think everybody out there could benefit from on, in relation to feeding, why babies do wake several times a night, whether they're cluster feeding or just newborns in general, about why they may be waking up to eat.
So, breastfeeding is protective against SIDS.
Yes.
And one of the things about breastfeeding is that they do wake more frequently to eat. The milk is easier to digest. It's easier on their digestive system. And so as they're waking multiple times during the night to eat, it helps to protect against SIDS because they're not falling into these very deep sleeps.
Yes.
And they're close to their moms. They should be in their mom's room next to the bed, in their little bassinets. And so they cue each other, the breathing and the heart rate cues each other.
Yes.
And so that frequent feeding, gets the baby up and engaged and, helps them reset a little bit.
Yeah. And I think that's a wonderful thing too. So let's talk about food a little bit.
Okay.
Because if anybody out there is like me and they love to snack.
Okay.
So does mom's diet directly affect baby's nutrition? So are there things that we should or should not eat while breastfeeding? I know there's a big, a big following around what you should or shouldn't eat while you're pregnant. Does that kind of follow into new motherhood and postpartum while breastfeeding?
It doesn't really. So the babies, it's a pretty cool thing about breastfeeding. They get all the flavors of the food that the mom eats.
Cool.
And so, yeah. And so that's how they know what's good. Um, and you want to feed them, different cultures eat different foods. And so whatever your culture eats, that's how your baby knows, well, this is what we eat because they get all those flavors. So we tell people, eat what you want, try to have a well-balanced diet. You don't want to have a ton of sugar and sodas, even if you're not breastfeeding.
Right.
Okay. But if you can try to have a well-balanced diet, that is going to equip you and give you, the nutrition that you need to make milk. And if you don't eat a well-balanced diet, the baby will get the nutrients it needs usually, unless you're totally depleted. But it'll get the nutrients, and then you'll have to catch up somewhere.
Some way, somehow.
Catch up, yeah.
Okay, and I have seen there's a lot of product on the market out there that is geared towards increasing your milk production, like the cookies and the tinctures that you put in your water. I've seen a recipe for oatmeal cookies that has certain ingredients that increase, quote unquote, your milk production. Is that true? Are there certain foods, processed or unprocessed, that could increase your milk supply?
So I'm not a big proponent of adding supplemental things like the oatmeal cookies. They're very expensive. If you make them yourself, they're probably healthy and a good snack. They're a good source of protein, and it's a healthy protein, but that's something you should be having in your diet anyway. I tell people make a big pot of oatmeal because it's easy. You can stick it in the fridge. You can take it out, heat up what you need.
Yep.
And it's easy for you.
Yeah.
So, some people swear by different kinds of Gatorade.
Mm-hmm.
I'm not going to tell somebody if it's working to stop drinking it if they really feel like it's working.
Yeah.
But that would not be my first go-to, because a lot of times people are not making enough milk because they're not removing milk frequently enough or thoroughly enough. Either the baby's not removing it or they're not. The biggest way to make more milk is it's a supply and demand. So as the breast is drained, the body knows to start to make more and put more in there again. So that would be my first recommendation before we started looking into like galactagogues.
Okay.
That's a big word for
milk like making. A dinosaur.
Milk making things. Yeah. Because you can eat and drink all these extra things, and if you're not removing milk enough, you're not going to make more milk.
Yeah.
So that's the first line.
It's another testament, I think, to just how amazing that the female body is and how we were created to just do this amazing thing, to grow a human, to birth a human, to sustain a human. It's amazing.
It is amazing.
So,
when I will just say as an aside, there are a few people, there's not a lot. There's a few people who don't make enough milk. But again, get some help.
Yeah.
If you're truly not, you're doing all the things and you're not, get some help.
And I think that is a wonderful segue into sharing what is a lactation consultant and how can we help?
So a lactation consultant has gone through many hours of education and training. They have to renew their certification every 5 years. They have to keep up their education. If they can help with all sorts of things. They're not just like coaches. They're people who actually do assessments and troubleshooting and help you work a plan. So if your baby's not gaining weight, they'll probably do a feeding assessment and see what the milk transfer is. And if that's not what it needs to be, they're going to help you with a plan for that. They're going to see, talk about your milk supply. How often are you feeding, or pumping, whatever you are choosing to do. And, talk about your low milk supply, your sore nipples.
Yeah.
Some people have hormonal problems that need to be looked at.
Yes.
And while they even aren't going to run the hormonal tests, they might be able to suggest what you need to talk to your doctor about running.
Yeah.
So there are a lot of different things that they can help with, not just latching your baby, but,
yeah,
any kind of trouble you might have. And I always tell people, if you feel like you're having trouble, don't really wait until it gets bad. Make the appointment, because sometimes they take a little bit of time to get in.
Yeah.
And if everything works itself out, then you can always cancel your appointment.
Yeah.
But don't hesitate to see a lactation consultant. A lot of people don't realize that there's help.
Yes.
And there's some good help in this area.
Yeah. It's a great resource, I think. And let's say, so a woman is giving birth at a local hospital, they typically have an on-staff lactation consultant, correct? So that will kind of make the rounds and introduce themselves. What happens when that woman goes home? Can she still reach out to that lactation consultant or?
So in this area, the hospital lactation consultants are not typically the lactation consultants that see you on an outpatient basis. You should get a list of resources when you leave the hospital of who you can call for help.
Okay.
You can do a Google search.
Imagine that.
There are a lot of lactation consultants now who are able to take insurance. So that's helpful.
Yeah.
Because they're medical. They can be expensive.
Yeah.
But they're still can end up being less expensive than taking your baby to the doctor and all the other things that come with not, giving your baby breast milk. And so, there is help out there. There's breastfeeding support groups. So I would encourage you just to take advantage of those things.
That is a great, great word about resources. So to conclude, not to throw you a huge curveball, but you've been with TPN almost a year now. And before coming here, you were on staff at a medical facility, a hospital. So what do you think your why would be for coming and serving the mission here at the Pregnancy Network?
Well, I think a lot of young ladies and women, they find themselves with these unplanned pregnancies, and they often don't realize that there's options available to them. They sometimes don't have the support that they need. Sometimes they just need to talk through things. They're scared. And that can we're a place that we can give people that support and help them to learn and, just help them through their unplanned pregnancy and just support any decision that they do make, but just to try to make a difference and help them overcome some of their fears.
Absolutely. Absolutely. Well, thank you so much, MaryAnn, for being here today and just speaking wisdom and knowledge to all of our listeners. We appreciate you and your time.
Thank you for having me.
And if you're interested in hearing more episodes of Pregnancy Has Entered the Chat, you can find them on our website. Thanks for listening, and remember, you've got this.